Good evening. This is Pastor Barbara, aka Preacher with Parrots. Today is late in the evening, almost tomorrow. It's February 15th, 2016. And I want to continue um, on a video that I started a couple of weeks ago called Pain Management in the Government. I had decided I didn't want any of the videos on this topic to be over 30 minutes, and I sort of quit before I got through. I hadn't really gotten to the government part. When I get through with this video and a few others I'll make on the same topic, you will probably want to Google um, some blogs, some articles. You may want to go see what's available on YouTube on certain subjects. Be sure that you do two things. For years, I've been saying the first. When you read what somebody says, it makes a difference who they are. I always enjoy reading things from Mayo Brothers, Johns Hopkins, Harvard Medical School. These are places you can trust, and if you have the head of a department that's been ahead of it for a number of years, you have somebody that's qualified to talk on a subject. Just having MD after your name may not qualify you as an expert on certain subjects. But now there's something else that if you're interested and you check me out and check out things that I tell you, and you Google and you look for information, you must look for the date. We're talking about things that happened in 2016. I have papers all over my desk and all over the keyboard and all over the sofa. Most of them are within this time period. But I was reading something here about pain contracts, and it talks about 2002, 2009. Very good material, but totally irrelevant now in 2017. First of all, over 30 years ago, I was in pain management. That meant you had pain. You learned to live with it. You took medications that helped control the pain, but didn't affect you in any derogatory way. And you learned to do some things in a certain way, in a different way, or not to do some things so that you could function and live in as nearly as possible a normal fashion, even though you were a pain sufferer. And pain management meant you managed your pain. Pain management in 2016 and 2017 means the government and or people empowered by them manage you. That's what I said. It started building up a few years ago when the government decided too many people were dying of overdoses or of drugs. So they wanted to get rid of people dying of drugs. Well, you can't say to somebody on the street that's a junkie, stop taking drugs. Uncle Sam doesn't want you to do that anymore. And they're going to say, oh, okay, we'll quit. We've done our last drug. It doesn't work that way. But the government can go to doctors and say, this is what you have to do if you prescribe, let's say, class 2 medications or drugs. Now, first of all, before you write a prescription, you must contact um, the State Department and make sure that this patient has not gotten a prescription from another doctor. Well, that'll take a little while. How much time do you spend with your doctor? 4 minutes? 6 minutes? 8 minutes? How many things do you have to discuss? Ways they're treating you, whether it's working, whether you need some adjustment, all of that, and you're supposed to take 4 or 5 minutes out to check on a patient. You've been prescribing the same medication for 20 years, and now this is what you have to do. Or you can continue prescribing for that patient, but you must reduce their dose. Now, if you're a doctor, you didn't give them a higher dose than what they needed. So if you're going to give them less than what you gave them in the past, means you're going to give them less than what they need to manage. Or doctors have another option. They can refer you to a specialist. Now, I believe it's 131 or 161. I think it's 131 universities where you can go to become a doctor, and supposedly only 5 are teaching anything about medication. How in the world have we gotten as old as we are by going to doctors who don't know what they're doing? I rather suspect it's the government that doesn't know what it's doing. And I'm pretty sure that most doctors have no clue where they're sending you when they send you to a pain doctor specialist or a pain clinic. I will tell you before we reach 30 minutes exactly what goes on. Been doing this for 2.5, maybe 3 months since something happened to me that was very stressful. I wanted to see how that could happen. I wanted to know if I should expect to have it happen to me again, and if there's anything I could do to avoid it. But to get back to 30 years ago when I was in pain management, and we learned how to manage pain and still live a nearly normal life for people who were not likely to get rid of this pain and who were being helped by a certain group of medicines that tend to work on a fairly large number of complaints or diseases or problems when other things don't work. First of all, the problem is mainly with people who take drugs recreationally, but beyond that, for people who are addicted to drugs or people who take drugs the way other people drink alcohol because they have a problem they can't handle. They get fired. So if it's alcohol, on the way home, they stop at a bar and get smashed and finally manage to get their car in their driveway and tell their family that we don't have any money anymore. There are others who, instead of drinking alcohol, do drugs. That's not the problem with people who take drugs because they have arthritis or peripheral neuropathy or all kinds of metal screws and contraptions that are now part of their spine, and they take medication so the pain will go away. Let's talk about the word dependent. I had a doctor ask me, "Are you dependent on medicine?" And I thought, yeah, I'm dependent on medicine in that if I don't take it, I will suffer severe pain. Just like a friend of mine who's a diabetic. If they don't take their insulin, they suffer severe reaction one way or the other, too much or not enough. That doesn't mean they should stop taking insulin. Just means they need to control it, and they are controlling it. Sometimes it's a little harder than at other times. So yes, a person depending on pain medication is dependent to the same way that a diabetic is dependent on insulin. That isn't the same as addiction. Well, what's the difference if it's not addiction? According to places like Mayo Brothers and Johns Hopkins and some other good authorities that I've looked into, the difference is not what you take. The difference is why you take it. Very few people that take, let's say, a certain pill. I wish I had one here. I don't. Let me use a coin. A person who takes this pill to keep pain at bay, and a person who takes it because they can't handle life, or they've just had a fight with somebody, or they've got problems they can't handle. This person will take it again and again, whether it's needed or not. The person who takes it for pain almost never gets addicted. It stands to reason some will. We're all different. There are, in America, people who've never had pain. There are people that reach age 18 and have never suffered the death of a close family member. That's not a bad thing. That just means there are people who have not had yet the opportunity to deal with problems. And when that opportunity comes around, some will deal with it better than others. So it stands to reason that some people who are taking medications for purposes of pain will at some time in their life encounter something they can't handle and maybe become addicted. It only stands to reason. The number is very low. It may be as high as 10%. But why should 90% of people who have benefited for years, who have never broken the rules, never taken a pain pill when it's not time to take it, never given it to anybody else, never gotten it from any place other than a doctor's prescription and from the pharmacy. Suffer because 10% are abusing. 90% should suffer. And who's to make that determination? Oh, well, the government, but what part of the government? Are they doctors of 30, 35 years experience at the head of some department in some large university or university hospital? Or just somebody with an opinion? Let me tell you what happens. As of mid 2016, it is considered that anybody that's had an accident or had major surgery should be able to get by on Tylenol after 3 days. Good luck. I don't know who wrote the rule, but I bet they weren't over 45. You go to a pain clinic. I had asked for a referral to a pain specialist because I have, in the last few years, developed peripheral neuropathy. Undoubtedly got it from chemotherapy. And then, of course, some of you know the story. My doctor did get it all. And when I decided I would just as soon die of cancer as die of chemo, and refused to take more chemo, and they did a PET scan, and PET scan came back, this patient has no cancer. This patient got peripheral neuropathy. That's a disease of the nerves in the hands and the feet. And it isn't something that happened like an accident, but it's ongoing. If it's not stopped, it's going to get worse. And that came about a while after the chemo stopped. And by the way, nobody said, we can give you this chemo. This might or might not happen. It was just everybody, including my surgeon, said, well, can't hurt. I got news for them. It can. I had a new doctor, and I hadn't been successful getting a referral to a pain specialist before, and I wanted to see, I had before used a TENS unit for a long time, and I was wondering if they had improved them or if there was something else, another modality that might help a new kind of pain that the medicine I was taking was covering previous pains, but not this pain. And I wanted to talk with somebody. I thought 1 or 2 consults. I wasn't looking for a once a month place to go and spend the afternoon. But I went to this new doctor and I asked if it would be possible to get a referral, and they said yes. He went on to tell me what a bad doctor my previous doctor had been, that he looked at the tests, that he looked at the prescriptions, and they were not adequate. That's not something you tell somebody you don't know. Now, those of you that know me know you can confide in me. But you don't say things like that to somebody the first time you eyeball them. A few days went by, and I had asked for a pain referral and been told I'd get it. I had been getting a prescription from my primary doctor for the last 30 years. That meant that at the end of the month, when I was running out of medication or about to run out, I would call and I would say, when would it be convenient for me to stop by and pick up a prescription? Will Friday afternoon be okay? Something like that. I probably would have called, except I was in the neighborhood. And I stopped in to my new doctor and I said, when would it be convenient for me to pick up a prescription? And wow, all hell broke loose. Finally, I said, excuse me, I think you expect me to respect you because you have a doctor's degree. And for who you are. So how about you respect me for who I am, what I do, what I've accomplished, and for my degrees, which are very close to yours. I've spent as much time at the university as you have. I said, your grandmother is my confidant. Your wife, I'm your wife's pastor, and I am your daughter's 6th grade teacher. That's who I am. I'm not a junkie. With all of this, I still didn't know that there'd been a change. So I kept my appointment and I was asked to sign a contract. And I thought, okay, I'm being asked to promise I won't drink alcohol. Not a problem. I don't drink alcohol. I'm not going to have a problem giving it up, am I? I don't abuse medication, so that won't be a problem. I did make a correction on it because, after all, I am a legal interpreter, and when I read a contract and I see an error, I just automatically correct it and initial it. But then found out that the minute, see, you walk in, you're in the parking lot, parking your car, you are a pain sufferer. You walk in the door, sign the contract before you've seen a doctor, before you've known if they can help your problem. You've signed a contract. I'm going to read you a little bit what they had to say about the contract. But from that moment on, you're a junkie. See, I can't go back to a place like that anymore. Would you want a pastor whose doctor thought they were a junkie? Would you want a doctor if a doctor was treating him like a junkie? Or would you want a school teacher teaching your children? These are not for professional, responsible, respectable American citizens, professional people. They're for junkies. And I really think that at least most of the people who work in these places are convinced that you could be a junkie. If you aren't, you will be. So we'll just treat you like one. This article was written some time ago. This one was written in 2010. Put out in the American Journal of Bioethics. And it was talking about, and I have a page or two missing, so I'm going to have to try to figure out what's in some of these pages that are missing. It's something I was trying out when I wanted to find out if I could make my new printer work. and all the pages did. Obviously, it doesn't work that well, and all the pages didn't print. This is by Myra Christopher, who co-authored the article. It says these contracts can be helpful if you have a patient that has either mental issues and can't determine what they will and won't do without some guidance, or if you have a patient with a history of substance abuse. Do I look like a patient with a history of substance abuse? These are not for them or for others, but for them, they may need the guidance, according to the two people who wrote this for the American Journal of Bioethics. Now, talking about abuse, if people are abusing medication that they're getting from their doctors, or if they're abusing medication, where are they getting it from? Between 2002 and 2009, we got a 7-year period. The people who took pain relievers for non-medical reasons, junkies, grew in 7 years from 11 million to 12.5 million. All but 7%, all but 7% that were abusing got their drugs from a friend, a family member, or a dealer, but not from their doctor. People that were getting a prescription from their doctor, 97% did not abuse. 7% abused. And 97% are paying, because the government, I guess, doesn't like those figures. Dr. Perry Fine, MD, president of the American Academy for Pain Medicine. I would think this guy knows something, right? Says pain contracts are okay if it supports patient health. Is it good for the patient's overall health? And is the patient not forced to sign it? If it exists so that a patient can review it and see what's expected of them, but not forced to sign it. Now, the problem is, according to Will Rose, CEO of the American Pain Foundation, is that the agreement is formed for patients who do have trouble following the rules. There should be a bioethical summit to discuss and advise the medical patient community on the ethical, legal, and cynical grounds for these agreements. I'll leave that particular article at that. I see that I'm approaching the 30-minute limit. I haven't begun to cover pain management centers, but I'm going to end this video, but we'll make another one. I'll see you the next time. Bye. God bless. Take care.